advent of modern technology, awareness, it has now become possible to cure a vast number or significant number of head and neck cancer patients, but it needs a symphony of players. It needs the infrastructure, it needs modern surgical suites like robotics and many others. It needs the highest precision radiology and PET scans and MRI scans. It also needs high precision radiation therapy. And as many of you know, we were the first one and with the largest experience of proton therapy in South Asia and in India, and head and neck is a classic site to be used, the proton therapy where it is used, and also needs medical oncology. It's also a site where you need a lot of rehabilitative therapists, the pain management, the anesthesiologists, the speech therapists, the swallowing function, and many other factors to it, such that you not only cure the patient, but also make sure that they lead very active lives and they contribute meaningful to the society.
We all know that head and neck management has always been a multidisciplinary management, and it requires a large team. And as Dr. Jalali rightly said, it requires a symphony of players.
These tumors of head and neck are so important, and so this thing, head and neck cancer burden in India is very high, and in the global, in the world. So I'll just like to introduce what is the Indian burden. So about 1 lakh new 1,30,000 new oral cancers are diagnosed every year in India, and it accounts to 30% of all cancers in India, whereas in America it just forms 3% of their whole cancer burden.
Not only the radiation had excelled in the treatment of cancer, the lot of advancements had come up in surgery as well. So we do have a robotic machine, and there have been quite a lot of changes in the immunotherapy as well as the targeted therapy, which is the systemic treatment involved. Cancer of the head and neck has only one chance. First hit is the best hit. And with the best hit, the chances of cure are high. There is no second chance in the treatment of head and neck cancers as such. So looking at that concept, we are now using all the newer modalities like the tomotherapy, the proton beam therapy, the surgical modalities. Now comes the role of a medical oncologist in the form of using neoadjuvant therapies, where the tumors can be shrunk to a smaller size. An inoperable or an unresectable tumor can be made operable by using all these newer therapies. Now the future is to have a head and neck as a combined modality and possibly achieve cure.
The preoperative, intraoperative, and postoperative, all three areas are so challenging for the anesthesiologist in terms of the planning. So we know in Apollo Proton Cancer Center, we do get complex cases like, like being a quaternary center, we get a complex head and neck cancers, like where the airway is totally jeopardized. So the planning is very important for an anesthesiologist who see the patient before the surgery is being planned. So, and especially the maxillary cancers, the mandibular ones, and most of them will be like after the radiotherapy, where the total mouth opening is so restricted. So the planning takes importance in giving anesthesiology, in anesthesia to the patient.
PET-CT allows assessment of the metabolic activity of the tumors, which is not there in routine CT or MRI scan. So the main advantage is that we can differentiate malignant and benign lesions with digital imaging. So it aids in accurate tumor characterization and imaging. So then the next one is that it is very nuclear imaging with PET-CT. It can identify many times in head and neck oncology. We simply find lymph nodes, but we don't find the primary site of disease. So PET scan can precisely identify small and slow growing tumors, which is very vital in the further management of head and neck tumors.
Wonderful teamwork where all this comes together, where this is like a seamless journey for the patient as well as for us as practitioners in the way we work together, and that is what makes it confident, that makes us feel confident that this center of excellence will truly provide excellent care to head and neck cancer patients.